Hello, lovely people. Greetings from the team, TammySisters, and we say God richly bless you for always taking your time to watch our programs. God bless you. Today, we are going to discuss a very wonderful topic, and it's all about the prevention of mother-to-child transmission of HIV/AIDS. And as I've already said, when we talk about HIV/AIDS, it's simply the human immunodeficiency virus. This virus, when it comes into the system of an individual, it affects the CD4 cells, thereby suppressing the person's immune system and allowing or making the person being prone to getting other infections. Okay, so when this virus attacks the CD4 cells, it reduces its number. So the body's inability, you see, sometimes when you are sick and you don't take any treatment, but you get well, this is the activity the immune system does for you when it's stronger. But when this virus enters the body or the system, it affects the immune system and it suppresses it. So its ability to fight other infections become a very big problem, and it also prone you to getting other infections also. So today we are going to talk about it and the mode of transmission. As we already know, sexual contact with an infected person, coming into contact with infected blood or any blood product, using sharp objects, blades, needles, pricks. When the person who used it is infected, you are also prone to getting the infection. So as I was saying, when we talk about mother-to-child transmission of the HIV virus, it is the most common way that the young children get infected. Okay, so from their mother to the babies, it can be transferred during pregnancy, it can be transferred during childbirth or breastfeeding. That is the simplest and the most common way that the kids get the virus. Okay, so that is why today we are taking our time to talk about it. And when this thing happens, how do we identify that one is positive whilst pregnant? That is why it is said that nowadays when you report to the facility that you are pregnant, you are expected to test yourself first. When you are negative, you are being cancelled. But before that, you will be cancelled, you will be tested. So when you are negative, you will also be cancelled again in order to take care of yourself for you not to get the infection. When you are positive we talk to you about it, keep you on the ARV drugs, that's the antiretroviral drugs, so that it will prevent you from transferring the virus from yourself to your baby. And once you are tested positive, we also advise that you bring your partner for the person to also be tested. When the person tests positive, then you both will be on the ARV drugs. You see, when you're taking these ARV drugs, it doesn't cure, but what it does is that it reduces the amount of virus in your blood or in your system. That's why after taking the drugs for some time, we check the viral load to know the amount or the number of virus which is still in your system. So when you are being tested and you are positive, you receive the ARV drugs. Then during childbirth too, you will make sure, or your midwife will make sure, that she practices that delivery in a very safe way, that point where the virus can be transferred at childbirth to your child will be prevented. So as I was saying, it is not advisable that when you are pregnant, because of stigmatization or because of shyness or because of anything, you should deliver in the house. Because when you are delivering in the house, the possibility of the person who is delivering you, maybe the person is not a skilled personnel, preventing that transmission at birth may not be achieved. So it's possible that when you are positive, you should make sure that you deliver at a health facility and a skilled birth attendant will take care of you, so that that point where there is a possibility of you transferring the virus to your child will be prevented. Also, at birth, once you deliver, your baby may be tested to know the status. Or at 10 weeks, the baby can also be tested to know the status. You see, most mothers, they have this perception or this intention that they got the HIV spiritually. So when you advise them to take the ARV drugs, they reject. Some will take the drugs for some months and they will not take it again. They will default. And at the end of the day, this baby that you are carrying, who knows nothing, comes out at birth and is tested positive, which is very painful. So this baby is going to grow up with the HIV virus right at birth. It's very, very, very uncalled for. So we will advise all our pregnant women, get tested, know your status, take the ARV drugs if you are positive to prevent the child from being infected, because it is very, very uncomfortable, very sad that at birth you test a baby and the baby is positive. It's very sad. So we advise our mothers out there, it's not a crime or it's not a death sentence that you are being tested HIV positive. Once you are tested, take your drugs as prescribed. Go for your regular routine checkups, your ANC clinics you attend, and you do everything as a normal human being or as every human being is doing. And at the end of the day, if your baby tests negative, it's a good thing or it's a good outcome that we are all seeking and looking for. Okay. So as I was saying, it's not like when you are on the ARV drugs, that's all. We mostly check on its effectiveness, and this is done by checking the viral load. That is the amount of or the number of virus in the infected person's blood. That will determine that the ARV drug is effective or not. Do not be sad or do not be worried when you are at term, you go into labor and the skilled personnel who is attending to you does not use instruments to deliver you. This is a means of preventing the transmission of the virus to another person. Okay, so mostly we ignore using the instrument. We use surgical blade, cord clamps to deliver an HIV infected person. These are all some of the modes of prevention the transmission from one person to the other. Okay, so do not be sad or do not feel neglected when you are not when they don't use the instruments on you. As I already said, once you are being tested positive and you are pregnant, what we do is that at birth we will check your baby. 10 weeks we will check, then 6 months we will check, 18 months you will check. Then when you have stopped breastfeeding your baby, 6 weeks after that, you also check. This is all the methods or the means of checking to know that your baby is actually negative. Okay, this is all that we do for you. And it's not like when you are HIV positive, you can't breastfeed. Once you are taking your ARV medications, you can practice exclusive breastfeeding. And if the mother decides or there is a medical condition that is preventing her from breastfeeding the infant, we advise the infant feeding, and we advise that the mother is able to store the feeds very well and take care of the bottles and everything that is used in the feeding to prevent any other infection to the baby. So an HIV mother can breastfeed the baby. What we advise is you do not default. You take your medications regularly, attend your ANC as necessary. Then at delivery, we do the necessary things for you to prevent the spread of the infection. And sometimes some people say that, Madam, I'm positive and I do not want my partner to know about it. It's confidential, but it's ideally that since it is a sexually transmitted infection or it can be transferred, it has several modes of transmission. It's best that you inform the partner. We call him to come for counseling. Then we test to know his status. Then when he is positive too, he will be on the ARV drugs and prevents this virus from going up. Okay, because the more the immune system suppresses, it's going to cause several other infections, which is not going to be helpful to his health. So please, this is a simple and a small presentation about HIV, that is prevention of mother to child transmission of HIV virus, simply known as the PMTCT, that we do for our pregnant women. Stay tuned. Next week, same time, we're going to discuss another topic. It's time with the midwife, and I am your host, Tammy Senior. God bless you.